Hello, I'm Amy Skilton, and it is my absolute pleasure to present to you today SIRS and Hormones, the influence of a water damaged building on hormone health. Now, if you're not familiar with what SIRS is, or more specifically SIRS WDB, we're going to start the session off with defining exactly what that is so you know what I am talking about. From there, I'm going to dive into exactly how this influences hormone health, or rather disrupts it. And at the end of the session, I'm going to take you through the various steps that you can take in order to bring balance back to the hormones in someone who has been impacted by a water damaged building. But let's start with defining exactly what SIRS WDB even is. Now, the acronym SIRS stands for Chronic Inflammatory Response Syndrome and is in fact a term that is an umbrella term describing several different variants of SIRS, including that which is caused by a water damaged building, which is why this particular variant is referred to as SIRS WDB. Now, SIRS, generally speaking, was first defined back in 1996 by a Dr. Richie Shoemaker in the US when there was an outbreak of Pfiesteria, and the fish that swam in the bay and even people who worked around the bay in his local area came down with biotoxin illness as a result of the exposure. Now, what he found was he used an old-fashioned cholesterol drug to treat the secretory diarrhea that was one of the presenting symptoms of this biotoxin exposure. And what he accidentally discovered was it helped many of the other symptoms as well. Now, for those of you familiar with cholestyramine, you'll know it's one of the earlier iterations of medications used for the treatment of high cholesterol. It's a bile sequestrant, and it also lends itself very well to binding biotoxins as they come out through the bile as well. Now, under the umbrella of SIRS, there are a number of different variations. Now, for today's presentation, I'm focusing very specifically on the SIRS that is actually triggered by exposure to a water damaged building. And you can see that in the first box here. And it's often referred to colloquially as mold illness, but in actual fact, a water damaged building offers a lot more than just mold, although that really is the visible proxy for what is going on. Having said that, underneath the umbrella of SIRS, there are a couple of other variants that you want to be aware of. Perhaps the most well known or most commonly heard of variant is Lyme disease. And that fits in this category here, covering the exposure to Borrelia by some sort of vector. Often it's a tick, but not always. And in addition to that particular pathogen, there's often stealth co-infections hiding in there too, whether that's Babesia, Bartonella, or something else. There are other biotoxins that can cause illness, including the one Dr. Richie Shoemaker first made this discovery over. And there's also a particularly unique form of SIRS called breast implant illness, which, whilst it's a chronic inflammatory response that is triggered, also entails the chemical poisoning from those that are actually introduced by the breast implant itself. But for now, let's get really clear on what SIRS WDB actually is. So it is a response from the immune system that in actual fact is both acute and chronic, but it's triggered by a water damaged building. And for a building to be classified as water damaged, any building materials that shouldn't get wet, that do get wet, and remain damp for more than 48 hours is classified as water damaged. Now, interestingly, it only takes 12 hours of dampness for bacteria to start to grow, but it's at about 48 hours onwards that mold starts to flourish as well. Now, we often think of SIRS as it relates to mold, and it is sometimes referred to as mold illness. However, water brings life to everything that is present inside a building. And when we consider a water damaged building as a whole, it is in part the presence of residential or resident toxigenic organisms that are problematic, mold being the one that we can see, but there are also bacteria and viruses, mycobacteria, and other microorganisms coming to life. And of course, they produce many different metabolites, including VOCs, endotoxin, mycotoxins, hemolysins, beta glucans, mannans, amongst many others that can cause illness. And so, what we know is that both in vivo as well as in vitro, findings show us that it's not just the mold in a water damaged building that can make the occupants sick, but in actual fact, a collection of the diverse inflammatory and toxic compounds that are present and the immune system's response in an attempt to clear these. Now, as far as how common water damaged buildings go, it is certainly more common than you might think. Statistically, we know that in Nordic countries, anywhere between 17 and 24% are water damaged. The Netherlands sit at 25%, and Canada and New Zealand sit at 37%. In the US, it's 1 in 2, or 50% of buildings, home or offices, are water damaged and therefore compromised in terms of the microbiome of that building. We don't have decent data in Australia to be absolutely sure of what our statistics look like, but it's estimated to be between 10 and 50% are water damaged. Now, I can tell you from my own personal experience that on one attempt to find a residential property to live in, out of the 300 that I examined, 98.3% of them were visibly water damaged. And the terrifying thing about that statistic is 80% of the time, water damage isn't visible. People often think of water damaged or moldy buildings as having visible mold, but mold is actually invisible to the naked eye until it reaches a level of growth that you can actually begin to see it. And so I would suggest that 10 to 50% is not only a very wide bracket, but potentially underestimating exactly how many buildings are water damaged here in Australia. But if we take, say, 50%, much like the US, as our average, that means 1 in every 2 of your patients is potentially battling the challenge that a water damaged building promotes. And therefore, it's a key and fundamental underlying factor in whatever they're presenting to you for that absolutely needs to be addressed. Now, a water damaged building can impact the health of every single occupant living in it. And in many cases, that might present as allergy type symptoms, or it might present as the common secondary complications of exposure, like multiple chemical sensitivity and electromagnetic field sensitivity. But in 25 to 34% of the population, there is a genetic haplotype or series of haplotypes that render those people even more vulnerable to exposure to a water damaged building. And they can very easily and very quickly go on to develop SIRS, or chronic inflammatory response syndrome. Now, Dr. Richie Shoemaker has mapped out the case criteria with which you can assess somebody and make a diagnosis ultimately if they fulfill that criteria. Now, there are a specific list of symptoms that are associated with this syndrome, and I will show them to you in just a moment. But they are divided into clusters. And if someone ticks 6 clusters, that is really an indication that a diagnostic workup or further investigation should be done. But in addition to that, if someone ticks 8 clusters or more, you can almost be certain that they are experiencing chronic inflammatory response syndrome. Now, often there'll be something in their history consistent with biotoxin exposure. In the case of Lyme disease, they may well remember becoming ill after being bitten by a tick or a spider or a flea or a mosquito. Although when we look at the data, that actual recognition of an antecedent or an event or a particular bite only occurs in about 25 to 30% of cases. Now, in the case of exposure to a water damaged building, because most people, A, don't know what to look for, and B, most of the time it's not visible and requires specialist assessment in order to actually pick up the mold in a home, a lot of people are not going to be able to say, oh, yes, I do have mold in my home. And in actual fact, I also find that many patients are reluctant to admit that because for many, they make an association between mold and a lack of cleanliness, which is absolutely not the case. Now, in the course that I've created for BioCeuticals on specifically SIRS WDB, I actually provide a long list of questions that are a much more effective and appropriate way of figuring out whether or not the building is water damaged, but in short, asking about leaks, burst pipes, funny smells, dampness, or even symptoms that come and go in certain rooms or when someone is away from their home is a very good place to start. Now, a free and easily accessible tool to use is the visual contrast sensitivity test. And this is a test that actually looks at the ability of the eye to ascertain visual contrast. Now, this is completely different to visual acuity, which is what optometrists test for. And so please don't let your patient get confused thinking that this is the eye test that they had done down the road at Specsavers. Now, this is not a specific or diagnostic test, but it is able to elucidate whether or not there is neuroinflammation in the brain that is affecting the optic nerve. You can, of course, fail a VCS if you've been exposed to neurotoxic chemicals and other compounds, but it is a good sign that there's inflammation there. And if those other boxes are ticked, then definitely ruling out SIRS WDB is a great idea. Now, one of the other ways you can tell whether someone is at risk is by looking at their genetic haplotype. You can also test for markons in their nasal cavity, which is a secondary consequence of living in a water damaged building and developing SIRS. One thing that's less easy to test is a rise in pulmonary arterial systemic pressure during exercise, but we often see in SIRS patients aberrant immune markers, particularly those that relate to inflammation and autoimmunity. But the best and easiest way to notice that something is going on that looks like SIRS is to examine the list of symptoms that are associated with this condition. As you can see here, there are 3 columns with a whole list of symptoms, and you can see that they've been divided up into categories or clusters based on the color in the cell behind the text. So fatigue sits out here on its own. Now, every human being feels tired from time to time, and if they've overdone it, can understandably feel a bit fatigued. But in the case of the SIRS patient, we see marked fatigue that gets in the way of them doing just daily life activities to the point where they may not have enough energy to shower, cook themselves meals, let alone exercise or go to work. And this is commonly diagnosed as chronic fatigue syndrome. So any patient with chronic fatigue syndrome, I'd be digging a little bit deeper to look at whether or not it is in fact SIRS that's causing this. The next cluster describes symptoms of weakness. This is where they feel just like they have been greatly weakened. I guess a real life example of where that might be expressed is people who could normally carry their groceries to and from the store to the car easily finds it feels so much heavier or so much harder to do it. Or if they're relatively fit and they're working out at the gym, they might find that the workouts that they have easily enjoyed up until now just feel immensely impossible at this time, like their strength and ability is being eroded. A decreased assimilation of new knowledge is very common. The brain inflammation that's triggered as a result of exposure to a water-damaged building can make it very difficult to learn anything new. Aches and pains are very common, and this very often looks like fibromyalgia. And I would also suggest that if you have any patients with fibromyalgia, that you make sure that they don't have SIRS, because I'm finding in my experience, commonly, that's exactly what it is. But the investigation has stopped at that diagnosis, and therefore effective treatment protocols haven't actually been engaged. Headaches are very common because SIRS is very much a case of environmental poisoning, particularly from the mycotoxins in the building, but also endotoxin and light sensitivity due to the brain inflammation. In the next cluster, we see memory impairment and also decreased word finding. Again, it happens to the best of us, sometimes searching for the word that we're looking for. But in someone with brain inflammation that has SIRS, the inflammation level is so high, they really struggle to find the right word quite frequently. It's very frustrating for them. And certainly in my case, for anyone who doesn't know, that I was diagnosed with SIRS back in 2017. At one point, I couldn't even remember my own name. And this is why Dale Bredesen has coined the term inhalational Alzheimer's to refer to the presentation in SIRS patients that looks just like Alzheimer's disease. The memory impairment, of course, is bundled up into that as well. Difficulty concentrating is also a common feature, and with the increase of inflammation and the raised glutamate levels in the brain, people can find it very difficult to focus on one thing, and it can look very much like adult ADD. Moving on from that cluster, though, we also have joint pain, morning stiffness, and cramps. So joint pain is very common, in particular in the morning. And so what you might find if you do a comprehensive symptom questionnaire is people might say that they're experiencing the symptom. If they're getting out of bed feeling creaky and old and stiff and finding it very difficult and painful to move around, or just simply difficult, if they say it starts to improve later in the day or even quite quickly after they get up, that's another red flag for looking into SIRS. Cramps are also very common because there's an issue with antidiuretic hormone and a lot of urine loss and therefore electrolyte loss, which causes an issue with the skin and also in the muscles with a loss of minerals. And what we see there is chronic muscle cramps. We also see in SIRS patients unusual skin sensitivity right all the way up to paresthesias, but even just general irritation and sensitivity, so things that might not have bothered them in the past start to really irritate and aggravate the skin. Tingling, of course, and numbness can also occur, as well as shortness of breath. Looking into the next cluster, we see sinus congestion and a cough quite commonly, and that is certainly true for patients that are still living in a water-damaged building or still being exposed. When we think about all the airborne irritants that are produced in a water-damaged building, just like pollen impacts those who get seasonal hay fever in springtime, the spores and the hyphae and the fungal fragments, amongst the other bits and pieces found in a water-damaged building, are inhaled and irritate the mucosa, setting off sneezing, runny nose, itchy nose, watery eyes, chronic sinus congestion or cold symptoms, and also a cough. We see excessive thirst for the same reason that we see cramps, that loss of fluid and electrolytes from the body, confusion, again, because of the issues with brain inflammation, and major appetite swings. I also commonly see major blood sugar swings, which may in part account for the appetite swings that we see. But because of the toxicity overload, the impact on the gut flora and the liver, we can see people quite limited with their diet. They find things set them off, and that can really put them off eating. And then other times they can feel incredibly ravenous and very, very hungry. We also see in CIRS patients a marked difficulty in regulating their temperature. So depending on where they live, if they live in colder climates, they might be the one that complains about the cold all the time. Even in summertime when everyone else is feeling quite comfortable, they're the ones that have always got an extra layer, a cardi, a jumper, a scarf, or even a jacket, or appear to be overdressed based on the current temperature. So look out for that when you are taking a case. But by the same token, if they live somewhere hot, that's someone who might really struggle with the warmer climate too. And essentially they can swing up and down almost without rhyme or reason. And you will notice that if they've been experiencing this for a while, they come prepared with multiple different changes of clothing or layers. Now, an increased urinary frequency is also a result of that loss of antidiuretic hormone. Sometimes it does affect them at night, but they might just simply say that they find that they have to urinate so much more often than anybody else, even during the day. Over on this far side here, we can see red eyes is very common, of course. We're seeing airborne irritants entering the eye tissue there. Blurred vision, although that is more to do with the brain inflammation. Night sweats are fairly common. Mood swings are even more common. Exposure to a water-damaged building, the mycotoxins in it, as well as the brain inflammation it triggers, can see people experience extreme anxiety, depression, and even rage and violence. We can also see them experiencing a very distinct type of pain called ice pick pains. Now, the best way I can describe what that would feel like is if you can imagine an ice pick, a very long, very sharp piece of metal being driven into your body. It can feel you can almost pinpoint, in fact, you can pinpoint the exact places where you end up with a sharp prick or something that actually feels like an ice pick driving into your tissues. Sometimes they're very small and they feel like a tiny pinprick. Sometimes it feels like you're being stabbed. Gastrointestinally, we know that there's a lot of factors that contribute to a compromised GI tract, but most notably mycotoxins and other compounds in a water-damaged building impact the microbiome. And so we see abdominal pain, diarrhea, classic IBS type symptoms, less so with constipation, but certainly with diarrhea, and often a loss of bowel control actually is a marked presentation I see in some CIRS patients. Tearing of the eyes, so watery eyes, again, this is more common if the person is still being exposed and less common if they have removed themselves from a water-damaged building. Disorientation, again, because of the brain inflammation, that very much that confusion. And a metallic taste in the mouth is also quite specific to CIRS. Static shocks because of the electrolyte shift in the body and the sodium accumulation on the skin. And feeling dizzy, vertigo. The best way I can describe it is when I was experiencing this, it felt like being drunk and hungover at the same time. It was an awful hybrid in between where you were wobbly on your feet, loss of fine motor control, felt dizzy and sick from being dizzy, headachy, nauseous, and very, very unclear. So those are the clusters, and if someone ticks 6 clusters, then it's definitely worth doing a diagnostic workup. If someone ticks 8 or more, they almost certainly have got CIRS themselves. So there are an awful lot of things that come out of experiencing CIRS and being exposed to a water-damaged building, especially if someone has a genetically susceptible haplotype. But a water-damaged building can impact hormone health in people who are genetically susceptible to mold biotoxins and those that aren't. And so, given we know the prevalence of a water damage building is probably 1 in 2 here in Australia, about half of your patients that are seeing you for hormonal challenges are potentially having them, at least in part, because of the home that they're living in or the office that they are working in. Now, there are several ways in which SIRS can end up impacting healthy hormone balance. One of the most significant ways is, of course, the way in which SIRS impacts sleep and creates insomnia type issues. But we're going to talk about the 3 primary drivers that SIRS or a water damage building and mold can have, and the influence it has on hormones. So the first one is the inflammation that it triggers. We know that exposure to a water damage building sees very specific inflammatory markers rise. And certainly in the case of a genetically susceptible patient like myself, that happens very rapidly. The markers to note are not the markers that would typically be checked by a GP for inflammation. ESR and CRP are not commonly raised in a SIRS patient. And because of that, many SIRS patients will see their GP asking to be tested for inflammation, only to be told that no inflammation is present based on just those 2 markers. Now, we know there is a whole raft of inflammatory cytokines and other biomarkers that could be tested for. But if you're looking for those that are specific to a water damage building, the ones you want to test for are complement complement 4A or C4A. It's a split product of complement, transforming growth factor beta 1, matrix metalloproteinase 9 or MMP9, and leptin. Now, these 4 biomarkers wreak havoc, creating inflammation around the body. But in addition to that, inflammation in anybody upregulates aromatase. And we know that aromatase plays a very specific role in converting testosterone into estradiol. And as a result, in both men and women, when their bodies are inflamed, in this particular context, by a water damage building, we're going to see an upregulation of aromatase activity, which is going to, A, reduce the available androgens for both genders, and is going to increase their estrogen levels as well. Now, that's going to present slightly differently depending on whether it's a woman or a man that you are treating. But in both cases, we see lower androgens being associated with a number of symptoms, including a reduced libido. And of course, high estrogen is associated with estrogen dominant symptoms, particularly for women that look like fluid retention premenstrually and other PMS type symptoms. Now, as a secondary consequence to that, we also have the relationship between estrogen and histamine. In the case of someone living in a water damaged building, histamine is going to be triggered. Histamine is one of those first lines of defense and an attempt by the body to wash or flush away or flush out whatever is triggering the immune response. And certainly in the case of the respiratory tract system, we see the watery eyes, the runny nose, the sneezing, the coughing, and all of those other fun symptoms. Unfortunately, histamine also increases estrogen production because it has a stimulatory effect on the ovaries. And as a result, this is going to have an additive effect to the raised estrogen levels on top of the upregulated aromatase. Furthermore, estradiol can in turn then increase histamine levels. It actually can elicit the activation of mast cells and therefore start to cause a rise in histamine. We can see actually a cyclic relationship between serum estradiol and also histamine. And unfortunately, this just feeds into the higher and higher histamine levels, and no doubt is a significant contribution to a common secondary complication of SIRS called mast cell activation syndrome. In addition to that, if that wasn't enough, estradiol also downregulates two of the three enzymes that are responsible in our body for metabolizing histamine: diamine oxidase, or DAO, and monoamine oxidase, or MAO. So on top of that, we also know that in SIRS patients, their cortisol is usually not expressed at a healthy level. In the early stages of the illness, for both physiological and psychological reasons, cortisol levels are often high, out of range, although over time, with the depletion that occurs across the board, they do tend to end up dropping down low. Now, because cortisol production is high initially, we can see the pregnenolone steal kick in and the loss of progesterone to oppose that estrogen. Furthermore, there are mycotoxins that mold produces that are specifically estrogenic. And some of these are found in water-damaged buildings. So toxigenic fungi associated with a water-damaged building can actually produce all kinds of endocrine-disrupting metabolites. But important mycoestrogens, or mycotoxins that have a xenoestrogenic effect, are zearalenone, zearalenol, and zearalenol. And these are produced by various fusarium species, and fusarium is one of the primary toxigenic molds that we see occurring in a building that has had water intrusion and has not been addressed appropriately. We know that it is such a powerful mycoestrogen that it has been synthesized and used for veterinary use and in agriculture, called alpha zearalenol, although the use of that is actually prohibited in the European Union. Now, fusarium is often found in different types of water-damaged wood and plywood, and it's producing a number of particularly toxic metabolites, including zearalenone, but fumonisins, moniliformin, as well as trichothecenes, which are particularly poisonous. But looking specifically at the mycoestrogen of zearalenone, we know through a lot of animal studies just how it impacts particularly female cows. In cows exposed to zearalenone, we see a reduction in fertility, we see abnormal menstrual cycles, we see swollen tissue because we know estrogen is proliferative, and certainly hypertrophy of estrogen-dependent tissues would be a natural response to a xenoestrogen. We see a reduction in the production of milk, and mammary gland enlargement are also commonly reported in cattle and swine. We also know that it causes heifer loss or calf loss in cows, so miscarriage, and any heifers that are able to be born as a result of zearalenone exposure tend to be weak and feeble and often underweight. It also interferes with the process of sperm formation. It interferes with a number of different enzyme pathways. And so arguably we could safely extrapolate that zearalenone is going to have a significant compromising effect on male fertility as well. And in human studies, we can see that it actually stimulates the growth of estrogen-dependent cancer cells and can also turn healthy breast cells into estrogen-dependent tumor cells. It can also lead to prostate cancer, ovarian cancer, and cervical cancer. So this is a very significant toxin that someone can be exposed to in their home or office. And certainly anyone presenting with fertility challenges, menstrual cycle irregularities, low sperm count, for example, or other high estrogen type symptoms, this is one of the things that can be at play that can easily go overlooked, because actually identifying a water damaged building can be really tricky. But in addition to that, one of the other reasons that a water damaged building can contribute to hormonal imbalances is due to the sheer overload of mycotoxins and other metabolites themselves. The liver is responsible for metabolizing all of our hormones, and if it has more toxic metabolites to deal with, we can see a bottleneck occurring. We can see a depletion in the key nutrients that are required for the metabolism of any toxicant. And in the case of water-damaged molds, there's just a very short list here of several different species and the different toxic metabolites that they produce. You can also see in the far column here some of the health effects that can occur as a result of the metabolites that are produced. But certainly these are all going to contribute to a liver that is already burdened, that may in fact have a flow-on effect to someone's ability to metabolize their hormones in a healthy way. Now, that can also occur because mycotoxins have an impact on detoxification. They impact not only the liver, but they also significantly influence, and not in a good way, the gastrointestinal tract as well. Indeed, many mycotoxins impact barrier function, causing or exacerbating leaky gut and impacting nutrient absorption. We see a shift in the histomorphology of the intestinal tract as a result of mycotoxin exposure, and many of them have a direct antibiotic effect. Perhaps the best example and the most well-known example would be penicillin. In a water-damaged building, all of the microbes are competing for water and for food. And some of their metabolites that they produce are in order to win the resources over other microorganisms, which is why mold produces antibacterial compounds like antibiotic penicillin. And living in a water-damaged home where you're breathing and absorbing and swallowing penicillin and other antibiotic-like compounds is certainly going to have a significant effect on your microflora. In addition to that, trichothecenes, which are a particular category of mycotoxins, can cause specific pathological changes to the lining of the stomach, necrotic lesions in the gastrointestinal tract, and also cause pathological changes in the liver. They've been shown to shorten microvilli, which we know is going to be an issue as far as absorptive surfaces go and the ability to absorb nutrients properly. They too contribute to leaky gut, and by reducing the amount of mucin-producing goblet cells, leave the lining of the gastrointestinal tract wide open for damage to anything else coming through. Zearalenone, which we just talked about, as a mycoestrogen, also induces epithelial cell death, and its metabolites decrease cell integrity. And interestingly, it also downregulates the expression of a number of tumor suppressor genes in the intestinal cells, arguably being a significant contributor to gastrointestinal cancer. Now, fumonisins, which are produced by Fusarium species, actually interrupt the metabolism of sphingolipids, and this can actually lead to an accumulation of sphingosine in cells, and elevated levels in the kidney, liver, and small intestine is actually very dangerous, creating oxidative stress and becoming cytotoxic, ultimately causing apoptosis in cells or cell death. It also contributes to the erosion of the integrity of the gut and destroys the mucus barrier. One other example is of ochratoxin A, and this alters nutrient absorption in the gut too, particularly also decreasing glucose absorption, which may explain some of the blood sugar swings that we see in patients that are experiencing SIRS. Ochratoxin A actually promotes faster and more harmful parasite infections. We see again a decrease in villus height and an increase in intestinal permeability. So all in all, when we know that the gut is responsible for 25% of detoxification, and we know that any gastrointestinal inflammation downregulates phase 2 in the liver, you can see how even just this one mechanism of action can mean water-damaged buildings interrupt healthy hormone balance very easily and very quickly. Now, looking specifically at the impact on the microbiome, we know that secondary metabolites that Fusarium produces have also been shown to have an antibacterial effect and produce several different compounds that are used as antibiotics in medicine today. Aspergillus species produce, again, a number of secondary metabolites that have antibacterial activity. Willemia sebi produces a particular compound that is used as a novel antibiotic. And so, how do we overcome the challenges of a patient presenting with hormonal dysregulation, only to discover that they're in fact living or working in a water-damaged building, and therefore getting on top of it is going to require a little more intervention than you perhaps first thought? So let's talk about how you would go about that. Now, it's beyond the scope of this presentation to present the full treatment protocol for CIRS WDB. And if you're interested in diving into that in more detail, the course for BioCeuticals is kicking off in just a couple of months. But here are some of the key basics that you absolutely must be across. First of all, any intervention that you offer whilst someone is living or working in a water-damaged building is going to have a very limited effect. You are not going to get the results that you expect, and you might even find some unusual reactions occurring as a result because there's this unknown entity in the background influencing everything that's going on inside that patient's body. So the absolute first step is to get away from the water-damaged building permanently and stay away from exposing yourself or the patient exposing themselves to any of those toxic metabolites and inflammagens and the other chemical stew that occurs in a water-damaged building. Now, in order to test whether a building is likely to be safe, we typically look for these two figures. Now, these two tests, the ERMI test and the HERTSMI test, you may not be familiar with, but they are tests that a building biologist can conduct on a space to actually determine how moldy it is and the nature of the molds present in that building, which will really show whether or not there's been water damage either currently or in the past. So the ERMI is the full test, and we're looking for a score of less than 2. The HERTSMI 2 is actually a sub-score out of that test, and you can simply run a HERTSMI 2 test on its own. It's a little bit more cost effective, looking at the 5 specific toxigenic fungi that tend to present in a water-damaged building. Statistically speaking, a CIRS patient essentially only has a 1% chance of relapsing in a building with a HERTSMI score of less than 11. Now, that doesn't mean something that scores well on an ERMI or HERTSMI 2 is absolutely going to be safe, but based on the data that we have, we know there's a 99% probability that it will be okay. Unfortunately, given it looks like 1 in 2 buildings are water damaged, finding a home that is not water damaged can be exceptionally challenging. And so many patients will end up camping or living in camper trailers or out of their car as a result, because it can take quite some time. Certainly in the case for me, it took 4.5 months of looking at 300 properties to find something. And so for anybody who has to leave their property immediately, it's not as easy as just simply walking into another place. Now, all other treatments for CIRS, with the exception of binders, cannot begin until a safe environment has been found, because not only is it wasting the patient's time and money, but in addition to that, it is also likely to result in intensification or an exacerbation of their existing symptoms. Now, the full 12-step Shoemaker protocol is covered in Module 6 of the CIRS WD course, and in Module 7, I explore the naturopathic equivalent, and you can see, however, there is a very specific order in which things are treated, and looking at androgen levels and hormonal imbalance actually has to come after the use of binders, treating mark-ons, getting their antibody levels down, which will also include a gluten-free diet. But looking specifically at the binders are used to capture the mycotoxins or the biotoxins as they are eliminated through the bile from the liver, avoiding that enterohepatic recirculation. Now, the absolute most efficient and effective binder is the cholestyramine that I mentioned at the beginning of the presentation. Although it's not well tolerated by all SIRS patients, if they are able to manage it, it tends to be the number one choice that practitioners will go for. There are a few other options like Questran and Questran Light that tend to be more well tolerated if CSM isn't. You can also compound your own to avoid artificial sweeteners and added sugar, and that is the ideal way to go. But all that said and done, avoiding the water damage building and binders is really ground zero for setting the person up for healthy hormones. Now, Welchol is another one that can be utilized if CSM isn't well tolerated. And lastly, a combination of natural binders will often produce a satisfactory result for SIRS patients as well, in many cases. And this is going to help capture the mycotoxins as they come through from the bile and allow them to be passed out through the stool. There is one other medication called Ultipraz that also helps the body to clear mycotoxins and really prevent their carcinogenic nature having as big an impact on the body. In rodent models, we've seen it inhibit the formation of cancers in a number of different organs, which we know to be associated with various mycotoxins. It also really helps the glutathione conjugation of mycotoxins whilst inhibiting that common oxidation and free radical production that occurs in the phase 1 detoxification stage in the liver, making it a lot more safer for patients to start to clear these. There are also a number of other natural compounds that have been shown to either alone or in combination to mitigate the oxidative effects of mold toxins. Liposomal glutathione is certainly one of my favorites. And N-acetylcysteine, of course, is a precursor that helps to upregulate glutathione production. Chlorophyllin or using supplemental chlorophyll is very useful. And so there are a selection of things that can be particularly helpful, even used alongside pharmaceuticals. Now, addressing the inflammation is this sort of two-pronged approach here. You can use anything that helps to downregulate aromatase, which we'll touch on in a moment, and anything that can downregulate the specific inflammatory biomarkers that are triggered as a result of exposure to a water damage building. So MMP9 and VEGF do tend to respond to a low amylose diet with either the medication Actos, which is a diabetes drug, or high-dose fish oil. In addition to that, looking specifically at normalizing androgen levels, allopathic practitioners are able to call upon DHEA. They might even consider HCG injections. And in the last step of the Shoemaker protocol for treating SIRS, the nasal spray using VIP can also be really, really useful. But from a naturopathic point of view, focusing on really down-regulating excess aromatase activity is a point of focus that can yield very good results also. So removing anything that might also be upregulating aromatase, and alcohol is a big one. Exposure to other toxins like glyphosate is another one. And of course, leaky gut and the LPS translocation that occurs as a result is another significant factor. Now, in patients that have genetic polymorphisms that see cytochrome P450, 19A1 upregulated are going to need to be even more strict with their approach because they're already battling a predisposition for an upregulated conversion of testosterone to estrogen. So there are a number of things that can help normalize aromatase activity. And some of these are because a deficiency in zinc, a deficiency in vitamin A, and a deficiency in vitamin D will see aromatase start to ramp up in an unhealthy way. So by making sure someone is replete in those nutrients, you can remove that as a cause of upregulated aromatase activity. Of course, losing weight is helpful because we know adipose tissue will drive aromatase activity. Gastrointestinal support is going to be useful. And certain herbs like turmeric and damiana can also be really helpful. Now, knowing that someone, particularly if they're still being exposed to a water damaged building or they're recovering from a recent removal, that their histamine level is going to be higher than we would like. Also, considering a low histamine diet would be useful. So, removing foods that are naturally high in histamine, as well as foods that actually trigger histamine release from the body, is going just to release that body burden a little bit further and interrupt that histamine estrogen cycle just that little bit more. Now, in addition to that, supporting histamine clearance is also something else you want to consider. Now, histamine N-methyltransferase is responsible for clearing histamine in the cells and tissues of the body. MAO or monoamine oxidase tends to kick in once histamine levels reach extreme levels. So it's histamine N-methyltransferase and DAO that you really want to be supporting here. So calling it HNMT for short, we can see that SAMe or methyl donors are important because the methyltransferase part of this enzyme requires it as a conjugate. And then we need DAO or MAO to take N-methylhistamine down further, and it requires decent levels of copper, activated B6, vitamin B2, and vitamin C. Those nutrients, of course, can upregulate DAO directly, and we see that DAO is important at clearing histamine in the lining of the gut. And so this is going to, over time, increase their tolerance to foods that they might have otherwise struggled to tolerate. Now, vitamin C is, of course, one of the important cofactors for DAO. And in good news, just 2,000 milligrams a day was able to reduce over a 2-week period histamine levels by 38%. And so adding vitamin C supplementation at a very tolerable and manageable dose is a great way to help support histamine clearance and really help calm down mast cells that are being particularly triggered at this time. Other flavonoids to consider are quercetin, rutin, and hesperidin. We know that they lend themselves to a number of different properties that are supportive, including anti-allergic properties, reducing mast cell and basophil degranulation. And just giving a little shout out to quercetin here, it was found in a particular study to significantly inhibit antigen-stimulated histamine release and was twice as effective as the pharmaceutical medication sodium chromoglycate at doing so. So quercetin is a particularly important bioflavonoid for patients that are in a water damaged building, especially if they're presenting with histamine symptoms. Lastly, vasoactive intestinal polypeptide spray is another really powerful intervention that is a pharmaceutical one. Now, this can only be used in the last step on the protocol, meaning all of the other biomarkers must be normalized before that is done. But it's a very interesting polypeptide that functions as a neuromodulator, neurotransmitter, vasodilator. It regulates smooth muscle activity as well as the epithelium and blood flow. And as the name suggests, is vasoactive in the intestine. It is synthesized and released by immune cells and is able to regulate a number of different genes in the body and have a number of different influences. And so this is certainly something that can be considered to help reduce inflammation. You can see here it improves VIP and melanocyte stimulating hormone levels, both of which end up low in SIRS patients. We also can see that it helps to normalize hormonal aberrations, including bringing testosterone back up and reducing abnormal estrogen levels, particularly in males, and it normalizes gene expression too. So all in all, it's a very powerful intervention, although there are many steps that have to be undertaken and completed before it can be considered. Some of those include that the patient has to be in a safe environment. They've passed the VCS test, meaning the bulk of the biotoxins have now been cleared from their body. Their Marcon swab is negative. Marcons is a particular type of resistant coagulase negative staph that colonizes the deep nasal passages and sinuses, and these can continue to cause inflammation in the brain and keep melanocyte stimulating hormone low, which means nothing else you do for that SIRS patient ever makes a difference because that is getting in the way. So Marcons needs to be clear. The pancreas is often inflamed alongside the liver with mycotoxin exposure, and so lipase must be normal. And the stress echo test looking at pulmonary artery pressure must also be in the normal range before you try VIP. Now, you can support liver clearance as well. Phase 1 requires a number of different nutrients in order to be undertaken properly. Phase 2 is also heavily nutrient dependent, requiring lots of those conjugation elements in order for the body to be able to eliminate the biotoxins. And of course, glutathione acts at phase 1, phase 2, and phase 3, making it an excellent choice for most patients. And so in addition to those particular nutrients, you can also consider supporting the liver herbally using bitter herbs like dandelion root, globe artichoke for the cholagogue properties to stimulate bile flow and elimination. Milk thistle to help provide some added protection to the hepatocytes themselves, and looking at mixed fibers to help actually capture some of those toxins that are coming through as well. And lastly, supporting the nervous system is really important. Experiencing SIRS, experiencing the challenges that come with a water damaged building, whether you own it, rent it, or are working in it, is very stressful, and we know that stress really causes the body to funnel pregnenolone into cortisol production for survival of that person who is undergoing levels of pressure and stress that are setting off an alarm in their body. As a result, however, we see hormonal aberrations occurring because of the loss of pregnenolone funneling down into DHEA. And so stress management is important, plenty of substrate from the diet, so good quality cholesterol is also going to be important, ultimately to help support all of these important hormones in the body. So that concludes the symposium presentation on SIRS and how it impacts hormones, ultimately disrupting and dysregulating hormones in both men and women. And whether or not that person actually has SIRS or not, they are still going to be impacted to one degree or another if they are living or working in a water damaged building. So I certainly hope that has given you some new food for thought as far as looking into what might be causing the hormonal aberrations in your clients, as well as some practical strategies in order to fix that. I certainly hope to look forward to seeing you on the panel. And if you have any questions at all about this session, please just submit them and I will be available in the chat to answer them.